Welcome to the GOODNITE Show, featuring your host, Jordan Geske.
Welcome to the What's Good podcast. Today we're going to do something a little different. I have with me today two guests, one retired from EMS and another who would like to stay anonymous. We're going to talk to them a little bit about what's going on with EHS, AHS, and some problems going on with healthcare in Alberta in general. Today with me is Don Sharpe, and we'll start with you if you want to do a little bit of introduction and kind of tell us what's going on.
Okay, thanks, Jordan. Thanks for inviting me.
Yeah,
we've been running a website called Where's My Ambulance for the last 3 years, and before that, I was a paramedic for 40 years, both small rural communities up north. And also here in the city of Calgary for a long time. I've taught dispatch. I've traveled and done some international work as a paramedic too. So we're just trying to fix some of the problems that we see and highlight what's wrong and try to make suggestions on how to make it better.
Okay, awesome. We talked briefly on the phone, and the two of you sent me over some information and kind of gave me an overview. I'm going to do my best to ask the right questions and kind of figure out what's going on, and then we can present this in the best way possible to get the story out there.
Great.
So I'm going to go over some questions that I have written down, kind of just outlining our conversation. And it's going to start with the leadership and systematic issues that have kind of been building up and compiling since 2009. And that's when the new AHS leadership took over. Can you kind of describe what specifically happened? And what shifted and how EMS was managed and how that's affecting the frontline performance today.
Right. So very quickly, I'm going to bounce all the way back to the 80s.
Perfect.
When I started in EMS.
Yeah.
And it was a pretty simple organization. It was municipally run. It was small town. We carried a radio. We got a phone call. We went down and got in the ambulance. We went and did our best to try to help people. Nobody had a CPR card. That didn't exist. But we had paramedics. And they had drugs, and they had protocols, and we did good work. But it was pretty simple, and it was pretty local. As it grew, of course, and the city of Calgary grew along with it, more paramedics, more computers, more complex protocols, more opportunities to serve, but then again, more problems too, right? So in a bigger city. So when the city of Calgary ran EMS in the city of Calgary, it was a monster service. We were premier service for North America. Our ALS competition teams would travel and compete with other teams from cities in Florida, Atlanta, California, and we'd often finish in the top 5. Terrific service. In 2009, when AHS took over, all of that local knowledge, that local control, that local heart was taken out of the ambulance services. A lot of the small rural services had full-time staff, but they also had backup staff, and they had backup ambulances and people that were trained and wanted to participate, just not full-time. So one of the advantages when AHS took over was they leveled up all of the care across the province. There were some places prior to 2009 between here and the U.S. border where there would be like a mom and pop ambulance service or an ambulance service that was staffed entirely by volunteers. So what AHS wanted to do was make sure there was a paramedic in each of these communities that was at the same high level and could provide the same service. That was a lofty goal, and it's actually happened. And that's good. The problem, though, has become this organization has grown so large and has so many administrators and there's so much infighting between over situations like dispatch. That's been a big controversy for years. Efforts to maintain rural coverage when the city was depleted. AHS implemented what they call a borderless system. And they say, well, you'll always get the closest ambulance. Well, the closest ambulance is no help if you're in Woodbine and it's coming from Vulcan. So the fentanyl overdose epidemic didn't help. COVID didn't help. But again, leadership has failed, I think, to grow and change, and they've also refused to accept suggestions from the front line about how to improve service and how to better care for people. And the idea that they can routinely just take all of the ambulances from local rural communities like Okotoks or High River or Cochrane and bring them into the city and keep them for hours to do calls here, leaving no ambulances in those communities, we don't think isn't fair. And that's kind of where my involvement started. I started looking at these rural communities who had no ambulance for hours and hours at a time, sometimes an entire shift, and some of the problems that was causing. And, I spent some time in some of these rural communities organizing citizen action groups for local citizens to lobby for better coverage of their communities. AHS has always refused to record or identify when these small communities have a red alert. In the city of Calgary, when there's no ambulances available, they say red alert, none available. But if it's a red alert in Calgary, you could bet there's a red alert in Cochrane because they've already taken all their trucks.
Yeah.
Right? So same in Edmonton. So, and again, the call volume, the hallway waits. When AHS took over, and again, this is my suspicion, I can't confirm this, but there was a lot that happened beside. I mean, imagine the city of Calgary. They give up the ambulance service to the province, so they're no longer responsible for probably $16, $18 million in operating revenue to keep the service running locally. The province assumes that cost. And also, the city of Calgary started charging AHS for space in the fire halls for the ambulances. So there's some additional revenue. Plus, they kept dispatch, and that's millions of dollars in revenue. The problem was AHS then decided, well, these are now our ambulances, and in a hospital-centric system, and this is the hardest part for me to accept. AHS is a hospital-centric system. The most important building and people in the province to AHS is the hospital. Yeah. That's why they're willing to allow hospital emergency departments to keep ambulance crews in the hallways with patients they refuse to accept for hours and hours at a time.
Just for people who really want to know more about that, do you want to, so basically what's happening is if I was in a car accident and my leg was sticking out, I broke it, and I got driven to the hospital by an ambulance in an emergency.
Correct.
What would happen is the rooms are full, or there's a lack of something going on, so they're actually keeping people out of the ER, out of the rooms, waiting in the hallway, and that takes up the time of the ambulance and its staff as well, right? Because they have to stay there, or...
Well, that's one specific problem.
Yeah.
In most cases, if you're seriously injured in a car crash or a construction accident, or you fall off your roof putting up your Christmas lights, when you go to the hospital, you'll go directly to the trauma room. You'll get excellent service. If you have abdominal pain, or some kind of mystery
asthma attack,
headache, or if you're short of breath, and the paramedics have actually treated you and given you some relief, and you arrive at the hospital and you're sick, maybe even in a lot of pain, but it's being managed, the hospital will say, well, we don't have any room in the emergency department right now, so we're going to have to get you to wait in the hallway. And that's fine. That started in about 2005, 2006, and we were willing to wait for a few minutes while they cleared a bed. But now it's come to the point where you have dozens of crews in multiple hospitals waiting for hours and hours on end. And remember that those crews are they're not able to service their communities, and the crews that are left in the field are working harder and unable to serve as well. So that creates a moral injury for the paramedics as well. Yeah, it's, and a lot of people...
Travel times are longer, which means that the time wait for the ambulance is longer. There's less people that they're able to get to, so that compounds. So a 5-minute wait, now if there's a third the ambulance is left or something, you'd be 15 minutes.
And the basic question is, what right does the hospital have to put people in the community at risk because they can't manage their problems? Now, I have some sympathy for these coworkers that I work with, the nurses and doctors in the hospital. I understand that Emerge is really not part of the real hospital, and that's maybe hard for people to understand too. But Emerge, when you look at Emerge, you almost have to look at it as a separate building from the hospital. If I'm a charge nurse in an Emerge department, it's possible I can come to work, and out of 70 beds in my Emerge, 40 of them will have patients in them that have been brought in They've been seen by a doctor, they've been diagnosed and treated, and they've been admitted to the hospital, but they're still in emerge.
Mm-hmm.
So as a charge nurse, I phone over to the main hospital and say, look, I got 50 people in the waiting room. I got 12 ambulance crews in the hallway.
Mm-hmm.
I've got 40 admitted patients in my emerge department. I need to get them out into the main hospital. And the hospital goes, you know what? Things in the hospital are pretty good right now. I don't want problems with nurses and housekeeping. So you got to keep them in there.
Yeah.
You know, and that's where the backlog. Now, disappointing. We had a paramedic phone and do the Saturday morning conversation with Premier Smith
Mm-hmm.
on QR. And he brought this up. And of course, the usual provincial bulletproof is, well, you know, we need 1,700 more long-term care beds before we can solve. Well, wait a sec. How does that hospital problem translate into it's okay to have somebody die of a heart attack in their living room after calling 4 or 5 times for a truck?
Yeah.
Like, they're literally destroying the ambulance service in order to save the hospital.
Yeah.
Now,
which
and
is
if,
terrifying.
And if that's what they're willing to do, then just say it. Just confess. But they don't. They say, we're working on this. We're trying really hard. We're making improvements. And we're just calling them out. We're calling them out.
Yeah. Somebody has to.
Somebody has to.
Yeah. Yeah. Let's dive into another part that you mentioned that when we talked on the phone was the no shortage narrative, right? So you mentioned there's no real shortage of paramedics, yet trucks remain unstaffed and response times are up. What's really preventing those available paramedics from being deployed effectively?
Right. So think about the job of a paramedic. These people come into the industry with a lot of training. They've gone to school. They've spent $30,000, $40,000 to get their certifications. Then you put them in a truck and you run them hard. We use the term unit hour utilization. So how much time do you spend on task doing paramedic duties, responding to calls, treating patients, waiting in the hallway every day? So unit hour utilization should be less than 50% because paramedics have other duties. They have training to do. They have trucks to clean. They have district familiarization to do. It's important to get out into the community and know where you're going. So they need time to eat. They need some time to rest in a 12-hour shift.
Yeah.
So when unit hour utilization climbs to 80, 90%, crews find themselves running from call to call. You clear from the hospital, there's another call waiting. Your shift is over, you're leaving the hospital, you're trying to get home, you're doing a late trip all of a sudden because you're the only now late trips are a real thing. They're a part of the business and we accept that. But if late trips,
what is a late trip?
A late trip is when your shift is over.
Yeah.
You've left the hospital, you're trying to get home.
Yeah.
But you're the closest to a critical call.
Yeah.
So they're going to give it to you and you're going to go because that's part of the job. But if it's happening 3 shifts out of 4, you can't do that for very long. If you've got, you get off at 5 and at 7 o'clock, you've got tickets for a show with your wife.
Yeah.
You're at late trip. You can do that once and she'll understand. You do that 3 shifts out of 4.
Yeah.
All of a sudden you got problems at home.
Yeah.
And problems in the rest of your life.
Which snowballs, obviously, mental health.
Right. Yeah. Critical calls. Everybody, it's not, and this sounds awful, but it's not, we see some awful things, right? And if you get a pediatric call that isn't successful, and you get a terrible car crash where you've got people who've been severely hurt and it's a lot of work and you got to clean up, you might need a minute. You know what I mean? And you might need some
breathe,
some mental health care. Yeah. And we get calls from paramedics all the time say, I'm just not getting it. I got rushed out of the hospital. They said, I know you're hurting. We'll deal with that later. Right now, you got to get back out there and do another call. It's like a war zone. Yeah. In a lot of ways.
That flows into one of the other questions that I had written down there, which is the toll on the paramedics, right? So there I had, you said many of the EMS staff are actually sick or burnt out from being overlooked. Like what does that now look like? How is it piling up on the day to day? Like, and how do you cope with the emotional and physical toll? Is there support? Is there something that's being done to help these people, or is it just not enough even if there is?
There's a lot of questions here.
Yeah.
We're going to break in here for just one quick.
Don was bang on, and I think it was the Parkland Institute that compared the rate or the number of registered paramedics that we have in Alberta to that of other provinces. And we have the highest ratio of registered paramedics in Alberta to, say, BC, to Ontario, to Quebec per person in the province.
That's an important point.
The phenomenon that was very prevalent, especially with COVID when it hit, was, as far as things go to mitigate the workload that was being dumped on the paramedics, it was virtually nothing on the side of our management. There was very little done. So one of the biggest phenomenons that we ended up experiencing on the front line was a lot of our full-time medics just said, I'm done. This isn't worth it. This isn't worth the cost on my family. This isn't worth the cost on me. I'm bringing my work home with me. I'm burnt out. I'm tired. And a lot of them dropped out of their full-time positions into positions that we call casual positions. So they get to pick and choose their hours. If they want to work one shift a month, they want to work one shift a week. If they only want to work Monday to Friday banker hours, they have that option. They don't have to work the night shifts. They don't have to work the weekends. They're not there on the Friday and Saturday nights. And that makes a big difference, because those night shifts, those weekend shifts, those are where we're getting slaughtered. And if you rewound the hands of time 10 years and you were applying for a job as a paramedic in Calgary, straight out of school, it wouldn't happen. You'd have to go to one of the very rural spots and start making your way,
Work your way up
to the city. Now we're so short that we are hiring people straight out of school to come into the city, and working in the city under these conditions is their first job. So they're coming in. This is the culture. The culture is this burnout culture.
Yeah, right away.
So very quickly, we're throwing these people into the thick of it, and we're burning them out too. And before
They haven't
long,
even built up that resilience yet. to be able
exactly,
to-
they don't have that resilience. And then before long too, they're starting to take the toll of, as Don was saying, the late trips that are just eating into their personal lives. And then they're either looking for their way out of the career, or they get on book offs because it gets to the end of your tour and you're just too tired. And it's very tempting to just call in sick, and the sick numbers, their sick call outs are just astronomical.
And is there any sort of new initiatives or support that's being offered at all to help like remediate or combat that? Like what have we seen? What is the government doing? Like,
The government's mandated everything to the leadership team.
yeah.
They've passed the buck to the leadership team. And this same leadership team is the same leadership team that was around 10 years ago. So they'll bring in a program or an initiative like, we're not going to give you a call in your last half hour of your shift unless it's a critical call. But the bar that they set on whether or not they're deciding, is this a critical call or is this a mundane call, is so low that it doesn't take much for you to be able to tell the dispatcher, this is a critical call. I need to get seen right away.
Mm-hmm.
And then all of a sudden, that crew that's in their last half hour, they're going to that critical call for somebody that has symptoms that could probably be dealt with by their family doctor.
Mm-hmm.
And that translates into, okay, well, now I have to pick this person up. Now I have to transport them to the hospital.
Since
No,
I'm here, it's quicker sometimes just to put them in the truck and take them.
Yeah. And I could understand like the disconnect is like the person calling 911 obviously probably is having anxiety and thinking that it is critical,
Absolutely.
right? They don't
Yeah.
understand because they're not fit to make these decisions, to be honest. And I see now they're trying to say, hey, if it's not critical, we'll give you a taxi or Uber credit.
Yeah.
To
I'm not a fan of that.
no, me neither.
No.
So there's got to be somebody more qualified than the Uber driver.
Yeah. Let's go back to your question. Sorry.
The toll on the paramedics, or
Right. Yeah.
yeah. So like the support, like is what could help on that side, I guess, is the next thing.
Right.
If what they're doing doesn't help, then what is the next step to make sure that support is getting set up?
Yeah, so that's a tough one, right? And I mean, as a large organization, they're mandated to look after their people when they get broken and hurt. And we do have a reintegration department, and they've got some great people in there that work really hard. But I think the job's pretty big, and sometimes the damage that's done is pretty big. And it's almost like you can hurt these people a few times. And I was hurt more than once at work, and I took time off and I got better, and I came back. But there are very few people, I think, now who are going to have a 40-year career in EMS. I think the average now is 8 years.
Wow.
And and the paramedics aren't maybe going to like what I have to say, but there's, in the old days, if you chose paramedicine, you got some experience, you spent some time in the truck, you decided if you liked it or not, and if it was right for you. And then you went to school and you got some training, you spent some money, and you made that decision. These days, a lot of times, paramedics come into the business, they spend a lot of money in school, and they show up, and I think after a year they go, you know what, not for me, but damn, it's a good job. I'm here now. I've spent all this money. Maybe I got a family. I'm kind of feeling a little trapped. I don't want to move. I think some of the people also end up in this job that were never intended to be in this job in the beginning. You know what I mean?
Yeah.
They're in the job. You can make a lot of money in paramedicine. In fact,
sometimes it takes a couple of careers to find out where you're actually supposed to be as well.
Right? Exactly. So,
and it sounds like a big thing too, is like, well, before you'd have to go through the ropes, you have to learn the system. You got to work somewhere else. You work your way to the big city. You work your way, you build the resilience, you become seasoned. Without that, like, to just be tossed in, it's like, that's not a way to build strong people.
And these new people show up and they go, and they're offered all this overtime as well. So, hey, I can work 4 days and I can work 3 of my days off.
Yeah.
And make good overtime and make bank. But you can only do that till you get to the cliff.
Yeah.
And then you got to recognize you're there and turn around. A lot of people don't, and they crash. We have more, there's more evidence these days too, that the shift work and the pace that this job demands is especially hard on women. And there have been a number of women who've come to us and who've also posted as well. I don't think she'd mind me mentioning her name. Jessica Vanderhoek has done a lot of work on just menses and period problems and women's health concerns that are miscarriages that are happening to our staff. And we're 50% women now. 50% of the paramedics are women.
Yeah.
So this is a big deal. We got to do something about this, and I think it's maybe more than the department is willing or even capable of managing right now, because they're just so overwhelmed with all the problems. Half of which, and I'm not letting them off the hook here, because I think half of the problems that they're managing right now at a leadership level are problems they created.
Yeah.
So.
There's a part that I want to come back to that, but we'll come back. I want to talk a little about like the human cost of the system, right? Some stuff more about like the hallways and the delays and like what is the real toll that we're seeing, right? This is a cost of fatality, of wait time, of permanent damage, right? And it kind of spirals. Or
certainly if you look at it as a process problem.
Yeah.
Which you're taking people who are in trouble and you're moving them through a system to get to the end where they're discharged either well or they don't make it out. But if you identify waste as time wasted or equipment wasted or resources wasted, and you try to eliminate those waste, I don't think we do a very good job in EMS of eliminating the waste.
Well, yeah, and when you look at it, like there's a good saying, like the big ship turns slow, right? The small ship turns fast. Like the more levels you have to go down on a boat, like the harder it is to turn it around.
Right.
And you're playing a game of telephone, right? So like you're like turn left and things all of a sudden it's taking a 10-degree right. That's not right.
And AHS is a big ship. I mean,
that's what I mean.
There's like 110,000.
There needs to be, it sounds like there needs to be a very large restructure and a lot of like movement on the bureaucratic side to be able to.
Yeah. And some recognition of reality.
Yeah.
Let me give you a good example. For years, paramedics were recognized as public safety professionals, and the people we align most closely with are police and fire.
Yeah.
We're out in the world. We're subject to dangers that nobody else faces. We wear stab-proof vests as well, because of, we work nights in the freezing cold. And for the last 10 years, 15 years, they've tried to ram us into healthcare. Well, you guys are more healthcare than you are public safety. And they changed our designation. We no longer have a chief and deputies anymore. We have managers and supervisors. And it sounds like they're trying to make us into a hospital. And one of the comments I've heard that I've repeated more than once is, I'll be in the hallway with a patient. And I'll say to the nurse, listen, you got to take this patient. It's on fire out there. I got to get back out there. My patients need me. And she'd say, well, we're all on the same team here. So I just need you to stay. And I go, wait a minute. I get it that you think we're on the same team, but I only ever hear that in the hospital. I never hear it at 3 a.m. on the side of the highway at 30 below by an overturned car where I've got people trapped.
Yeah.
I don't ever see you on my team out there.
Yeah.
So
your goal is to get the people from and to.
Yeah. And I don't say that to
not
denigrate, emerge staff. They do very competent. They do great work, but they don't do what I do. And I have no business. In my opinion, triage is where the exchange of patient care, the patient responsibility should happen. I should never wait in the hallway.
It's a lot to think about, hey?
Right?
And we have more, and we'll cover some of the other stuff that you sent me too, I guess.
I wish
when
it was.
When it comes to like the failures, like where's the place to start, and what is the path to reform? I'm going to kind of merge a couple things together here, but like from your perspective, the budgeting failure, the leadership neglect,
I think
the systematic processes that are building up, right? And the harder it's getting to fix them as they keep continuing to grow, right? Like how you said, when it started in 2009, it was a 5-minute wait or 3-minute wait in a hallway. And now it's turning into an hour plus in a hallway. Like what right now is the path to reform, right? Like if you're given the opportunity to sit down, what would you say is the first step?
Well, you got to recognize the reality of what's happening. And a lot of people, I think, are distancing themselves or turning a blind eye to what's really happening. Okay. And they don't want to talk about it because it doesn't affect it. It doesn't match with their ideological worldview.
Yeah.
Do you know what I mean?
Yeah.
And those are big topics. Those are federal topics like immigration and healthcare, naturopathy, all of those things. When you take a look at the micro, like each of these, and that's what I really like about what Danielle Smith did with AHS. And she, I heard her speak probably 6 years ago at a talk put on at a conference by Danny Hozak called Freedom Talk. And she talked about how she was going to break AHS into these silos and make them more accountable. And I think that's really a good idea. Now, there's lots of problems with Recovery Alberta that was broken away from AHS, but there's an opportunity there to make people accountable for that in a more effective way. And the two biggest problems at AHS are transparency and accountability. And that's why we have to do all these FOIPs. Right? When we fill out this FOIP request, because nobody gives us information for free. And sometimes they dump it on us in a big pile. So accountability and transparency are the two biggest problems at AHS. So break it up into smaller ideas, like having EMS and EHS is a great idea, but make it accountable. And make these people that are running it accountable. And I don't think, based on what I've seen so far, is that there's going to be any accountability at all. And that has to come from the government. So this government, this premier should be looking across the table at the people running the ambulance service and say, how are things going? And if she doesn't get 2 thumbs up, then she's got to step in and go, okay, what's the problem? Like, fix it or you're fired. And we'll get somebody who will fix it.
There was just a big change in Calgary. First mayor to not get reelected in 45 years and the biggest turnover at city council in Calgary history. What do you hope at a municipal level they can do to support you guys in getting this information out there and getting the support that you need? Even if it's not in their playing field, you'd expect that it's their citizens, it's their city. You'd expect they'd lend you the support and they speak up on your behalf and that they help you get the resources that you need allocated. Right.
So 4 years ago, when I started recognizing what was happening in the rural communities, same thing, just the micro of the urban. As I booked the community store, the Legion out in Cochrane, talked to a local journalist, was on the radio very quickly, had 100 people show up. People are interested in advocating for what they want. Do that here.
Yeah.
Like I really think that EMS should have a commission like the police commission.
Yeah.
That examines closely what they do, that has citizen members. I've always thought that we don't do a good job of planning for the future. We don't have any kind of a cadet program like the fire department has. We don't have any junior paramedic program. We do these job fairs. We go to schools and events, but I just don't think the municipality could probably do more that way, advocating for, and if EMS isn't going to set up a commission, set up your own commission.
Yeah.
Make an MLA responsible for EMS, because it's a real problem. We deal quite often with mayors of these small towns. We've sat down with, I've spoken in front of many rural councils.
Yeah.
Quite often I've spoken to rural councils after they've had a presentation from EMS, giving
I bet those are a
EMS's
little different.
Oh yeah. And I've sat down with counselors because this is a complicated subject, and counselors often don't know what to ask.
Yeah.
And they don't know what follow-up questions to ask.
Yeah.
So we sit down and try to get some FaceTime with them, with the CAOs as well. There was an attempt a couple of years ago in places like High River and Okotoks. AHS decided they didn't want to have us sitting in the gallery watching and commenting. So they asked the councils if they could have the meeting in camera, in private, because they had some secret things they wanted to share with them. Well, we found out afterwards that there was nothing secret, that they just wanted to do their presentation to council away from our prying eyes.
Wow.
And so Mayor Snodgrass in High River publicly scolded EMS at the next council meeting and said, if you're going to try and do that again, don't even come down here. So let's recognize what's really happening. Let's recognize how irresponsible AHS has been. Let's start asking good questions. Let's form a group of people led by, if you want to talk about what can a municipality do, form a citizen action group.
Yeah.
And ask 10 citizens to get together and have them FOIP information from the government. Do what we do, but do it on behalf of the city, and then present to city council.
Yeah.
And then city council can go to the province and say, this is what we're looking at.
Yeah.
Why is this happening?
Yeah.
So that's one suggestion.
If there was something that you could just get out there to the goaltenders, right, over at the hospital, like something that you could say to make them help understand, hey, these people need to be dropped off, right? Like what do you think could be done better on that side? How could you deliver your message to say, hey, I know you guys are busy too, but if we don't go out, people die, right?
Yeah. Well, they're making, I think the latest one I've read is from North York Hospital, where their ER has broken their hospital ER has broken it into sections, green, purple, red, where they deal with breathing problems here and broken bones here. And I'm not really an expert on fixing emerge. There's people like Dr. Grant Innes, who's very outspoken about the changes. He says there's always something you can do to make ER more efficient. You've just got to start looking for those things. And I think sometimes they're just so overwhelmed that they're just trying to survive. And you hear talk these days of how difficult it is to get nurses even to stay in the profession. And ER is a specialty, just like ICU or the cardiac unit. ER is a tough gig. And I got a lot of respect for the nurses that work in the emergency department. I wish there was more I could do to help them. My priority is my patients.
Yeah.
My priority is my partner and the system that I'm trying to keep alive. So.
Yeah. Yeah. No, that's well said. I think what we'll do, Donovan, if you want to go over to some of the stuff that I sent you, these charts that we'll pull up and just explain what's going on. And if you want to start, you can direct Donovan to whichever one you want to start with. And if you want to kind of give your story from the numbers side so that you can open people's eyes to what's going on. And we'll put some of this up on the screen as it's explained.
So what we're essentially looking at here is the over-reliance that the system now has on overtime. Overtime isn't just a, hey, we had a couple people book off. Do you want to come in and make some extra money? It is now part of the operation. If we don't have overtime going out the door to fill shifts. We're not filling ambulances, period. And that translates into these astronomical numbers. So we see Edmonton and Calgary roughly running about $500,000 each just to staff trucks in both cities. What's been found is these numbers roughly translate into a few hundred extra ambulances being added to the road over this period of a month. So it's not much, but those few hundred ambulances do make a big system difference.
Really the breaking point. Like if for any reason at all, if the system could not use casuals and overtime, for instance, everybody's on strike these days, the world's on fire. The medics haven't had a contract for ages. They're getting kind of cranky. If everything were to stop, like job action wise, they couldn't use casuals, they couldn't use overtime, the system would collapse. So, yeah.
So what we end up seeing with these numbers is a lot of these people are coming in to supplement their incomes. So they're going to look at their days off and say, okay, I can take an overtime shift here. I can take an overtime shift there. The big thing that right now our employer is benefiting from is the pay is so lopsided between the paramedics and our other public safety partners. And that's not to say that police and fire don't use overtime, but we cannot function without it. So if there was a realignment and the system was recognized as paramedics are part of public safety, paramedics needed to be treated like our public safety partners, I suspect that you would see those numbers come down. That being said, you have to align the wages of the paramedics with what those other public safety partners are being paid, because right now our wages are so out of whack with what the fire departments are paying, with what the police services are paying. We actually found in a conversation with somebody recently about our dispatchers, a dispatcher for the city of Calgary will top out at $51 an hour. A dispatcher with EHS is going to top out at $34 an hour. So that disparity kind of speaks to why there's this heavy reliance on overtime. And if nothing's going to be done about that, then this pattern is going to continue.
Yeah, so families are relying on overtime now with the cost of living going up.
Yeah.
And guys are putting in, and gals are putting in extra shifts.
The cost of living is insane right now.
Yeah.
So there's a perfect example. You spend $500,000 in one city. In May, you're getting an extra 514 ambulances. June, 492. And then you look at the previous picture and you're going to see what we're getting in Edmonton. Basically the same thing. Edmonton's a little lower in July and August, but May and June is almost perfectly aligned. And what's happening in Calgary is also happening at Edmonton. The cities are usually two mirror images of each other. There are idiosyncratic differences between the two cities. There's some managerial differences, but for the most part, the leadership all marches in lockstep, and the problems then translate into the exact same thing. So this is kind of a decent representation of something that we have going on that's basically shows that in both cities, no matter what happens, we're always going to be sitting on these vacant positions. And it's been like this for years. And they're going to say we're hiring at a rapid rate. We've got all these initiatives. They don't translate over into anything though. We're still having 114 vacant shifts in Edmonton. We still have 97 vacant shifts in Calgary. And then what do we see in that bottom picture? Well, we've hired 7 extra people
Not
for
even
Calgary.
1%.
We've hired 9 extra people for Edmonton. You're not even hitting that 10% mark.
Yeah.
And this is happening all the time. And something I found that was absolutely preposterous recently in Calgary was you have these 2 superstations and you have a finite amount of, we'll call it classroom space or training space. So you've got one big station up in the north where they have some training space, and then you have another station in the south. Training space is a little more limited, but it's there, or you won't have as big of a space. But they turned that space that they had in the south station into extra offices for managers, extra supervisors.
Oh yeah, there's no training these days. That's one of the biggest complaints we get from medics is we're not getting any training. And if
The
you don't
training-
stay current, I mean, there's halo calls, those high acuity, low occurrence calls,
Yeah.
where people require critical interventions right now. If you don't practice those
Yeah.
on a regular basis, you're not good at them.
Yeah.
So
Yeah. Something very technical that happens 1 out of 500 times or something, you mean? Like, yeah. Yeah, I could see that.
And we get 2 days a year.
That's crazy.
2 days a year. And I'll tell you right now, the stuff that they've jam-packed into those 2 training days that we get a year is nonsense.
yeah, some of it's that ideological nonsense that we talked about earlier. You know, the DEI or the gold standard for capturing a patient's airway is intubation, where you use a lever and you pop a E-tube and endotracheal tube in and you secure that airway.
Yeah.
They actually came up with a protocol that if you're closer than 30 minutes from the hospital, use a basic airway and transport. Don't take the time. And part of it was because they found that intubations were becoming less, paramedics were becoming less and less successful at intubation. Now, why was that? And that corresponded directly with the decrease in training.
Yeah.
And there were a couple of paramedics who are, I mean, paramedics are they're A-types. And I wouldn't want to manage a group of paramedics. They're tough. Like, you got to be a great leader to manage them properly.
Yeah.
A lot of these paramedics said, I'm going to intubate people anyways. And some of them were called in and lectured, and they said, I don't care. I'm good at this. I practice it on my own time. I make sure I'm qualified. This is the gold standard. That's what I'm going to do.
Yeah, which makes sense. Yeah.
Yeah, and those are great paramedics. I got a lot of respect.
And then to be reprimanded for being successful.
Correct, yeah.
For saving lives.
For doing what they're trained to do.
Yeah.
Gold standard stuff. And that's the other thing. I just don't like compromise.
Yeah.
You know, there's medicine changes all the time, and we need to change with it. We used to put everybody on a spine board. Now we don't.
Yeah.
There's new drugs. You got to know how to use them. There's better drugs. You know, if they give you a choice between 2, you've got to be able to choose which one you think is best for this patient. That doesn't happen in a vacuum. So
actually, you did bring up paramedics being reprimanded. That's actually a really good
the culture.
That's actually a really good subject to talk about right now, because we've talked about burnout. We've talked about moral injury. We've talked about being pushed to your breaking point. Now let's talk about what happens if you get a complaint. Let's say someone's dissatisfied with the fact that they're getting an ambulance bill, or they're not satisfied with what hospital they were transported to. Or maybe it's 3 o'clock in the morning and the paramedic didn't have a big enough smile on their face. They can write whatever they want on a complaint form and send it in. And there's an almost guarantee that that paramedic will now be subject to a thorough investigation. There won't be a discretionary piece where a supervisor is going to look at that and go, this is nonsense. The HR team is having that paramedic pulled in, having that paramedic brought up, and they are very happy to push the discipline button. And I think that part of that is just because they realize that the staff is at such a boiling point.
Yeah, the tipping point. I was going to say it's a snowball effect, right? Like, you guys are so overworked that you might be not in the best mood. You might, you know what I mean? Like, so to get a complaint is like, wow, the complaint isn't really that you weren't in the best mood. It's that you were put in this situation. So for it to be coming full circle, and it's interesting because this situation is one that you were put in, and you're the one being reprimanded for it.
Yep.
Paramedics self-regulate very well.
Yeah.
Unless they get damaged.
Yeah.
And then they're frequently put into conditions where, I mean, we walk into chaos all the time. And if you walk into chaos and you're high strung and you're on edge, that's a terrible environment for you to be in. So paramedics need to be well looked after so that they can do I had a really good, she was the mayor.
They need support, not over management, right? Micromanagement. Yeah. They need support.
We did one of these citizen action groups we did in a rural community. A mayor from a neighboring town came by, and she came up to me afterwards after listening to our stories and talking about what was happening. And she said, you know, I want to go back to my town and I just want to put my arms around the paramedics and I want to protect them. Not from anything, but their own managers. She says, I need these people to be rested and ready and at their best when my citizens need them.
Mm-hmm.
I don't want them spending half the night in Calgary and then coming back here exhausted.
Yeah.
I don't.
Yeah, exactly.
I don't want them being sent to cover a neighboring town and having to come back lights and siren for 20 minutes just to. She said, I want to keep them here and I want to look after them. And I thought that's exactly the kind of attitude that municipal leaders need to have about their paramedic staff. When I was younger, before 2009, we used to go to community events. Every Saturday morning we would book on. We'd take a look at what was happening in town, and if there was the Down syndrome run was happening here, or somebody was doing a swim meet or something, we'd go over there and we'd say, hi, we're here, we're the paramedics. And if we had to leave and get a call, we'd leave and get a call. But we tried to get out. There's zero time for that anymore. Your local paramedics are now so busy running around. The only time you'll ever see them is when they're rushing into your house to save your life, or to look at you with your 3-day abdominal pain and say, what do you want? You want to ride to the hospital?
Grab a taxi.
You got 2 cars in the driveway. You got an adult son and your wife. You got to call me to what? It's just such a varied thing, and it's a tough job. But I'll tell you, it's a great job. I would go back tomorrow if I was younger and stronger. But the environment right now, we've even gotten a call from one of the educators at SAIT, and he said, Don, I just had to phone and tell you this. In 23 years, this is the first time I've ever seen empty spots in classes at NAIT, SAIT, and Medicine Hat. These are subsidized advanced care paramedic program class spots. They're sitting empty. He says, and I talk to primary care paramedics and I say, hey, there's an empty spot. Why don't you sign up? And they go, are you kidding?
Yeah.
For more responsibility in this environment? For not enough pay? No.
Yeah.
I like my casual primary care paramedic spot.
Yeah.
This is what I'm looking for a way out.
Yeah.
So.
It's funny that you mentioned that too, because those primary care paramedics, right when that conversation that Don just alluded to has happened, they've been out now. They've come to work on a car for a month, however many weeks it is for their practicums. And they have had 2 preceptors that are at the end of their rope. They're tired, they're underpaid, they're underappreciated. So the student gets to see from their preceptors the bad attitude, the frustration, the system is broken mentality. But not only that, they get to be in the back of the truck as the truck is being thrown into this dysfunction. They're getting to experience it firsthand. They're not coming in and thinking, oh, wow, this is great. We just did a big call. We're back at a hall. We have a second to cool down. We can drink our coffee. We can chat. We can...
What'd you think of that last call? Yeah, that kind of chat.
Exactly. What'd you think of that last call?
There's no time for that.
There's no time, 'cause you have that...
That's insane.
Now you get maybe a half hour to cool off and say, yeah, what did you think of that last call? These are conversations that sometimes need to be broken down over an hour, 2 hours, especially if it's a big one, and you don't get to have those conversations. And then the student is also seeing how little that we're being paid in comparison to the firefighters.
Yeah.
I mean, one of the things that Danielle mentioned in that conversation that Don was talking about on that morning show is she put forward a contract proposal that'll make us one of the best paid in Western Canada. Like, okay, well, hang on a second. Let's stop and talk about that here for a second. Yes, fine. We're being offered a contract that's going to pay us more than Saskatchewan. It's going to pay us more than Manitoba. Those 2 provinces, their populations could fit into Alberta, and we'd probably still have some room. Okay, so let's look over at BC. A top primary care paramedic in BC is going to get paid $46 an hour, and they're going back to the negotiating table in March. So they're going to get paid even more. Now, the new contract that they just offered us doesn't even get us close to the top wage in BC. We're still, I think, $4 off of that if you're a primary care paramedic, and that will be it for 4 years. Now, if you're an advanced care paramedic, the contract increases they offered you are even less than what they offered the primary care paramedics. So people who had significantly more education, significantly more training, they've dedicated significantly more time, money, the emotional bandwidth to the career, and they were offered less. What a slap in the face And then to say that we have created this contract that's the best in Western Canada or one of the best in Western Canada. It's simply not true. And they won't even acknowledge what paramedics are getting paid in, say, Toronto, in Ottawa, in Peel region, because those wages, they surpass ours by leaps and bounds. It's a big issue, and these new students are going to get to the school, they're going to see these conversations happening, they're going to hear these conversations happening, and they're just going to go, yeah, no. And the unfortunate part is we need them. Right now, we need them to be stepping up to the plate, to becoming ACPs or advanced care paramedics in a big way.
Alberta needs it.
Like, in a big way, because we took so many advanced care paramedics and we burnt them out, and they just said, I'm done.
Yeah. Yeah.
And that was only the fault of EHS management. The same managers that were running the show when COVID first broke. Guess what? Now, today, they're still managers. We got rid of a few. That's awesome. Some of them that we got rid of were definitely people that needed to be got rid of.
We suspect they would have been, I thought they were going to be criminally charged. I really did. I thought some of what they were accused of, what we thought was happening, would have resulted in criminal charges. But no, they just disappeared.
Yeah.
And they're gone. And you can even, some of them on LinkedIn have new jobs, doing other stuff. But
same sector.
You never hear exactly what happened. Again, there's that transparency and accountability issue.
Yeah.
So, do you remember last year when at the Alberta Paramedic Association meeting where one of the leaders from AHS stood up and said, we're hiring all these new people from other countries, especially Australia, they were talking about. And I don't know how many, I think they maybe had 2 start in Saskatchewan, but they even talked about how they're going to be careful not to take too many because they don't want to decimate the services in this country.
Yeah, where are they?
It was all baloney. It's all malarkey. Yeah.
They never came. They never went. They never sent a single person overseas to try to recruit any of these people. Not one, but they talked about it like it was the best thing ever. And
AHS had conversations with people in Wales and in BC and where else are they going? Nova Scotia.
They just do it for the headline. And the thing is that you live in this world where headlines last. It's funny because headlines last a long time because the next one comes out so fast. Does that make sense? So
it sure does.
You don't keep up with the story. You only remember the last headline because now there's so many new stories that come out so fast that if you pump out a headline, it's actually not that you forget about that story. It's that you're now keeping up with 20 more stories by the end of the day. So that's the last thing you're going to hear about that story. So as long as they get some good press and that's the last thing they hear, that's all they have to put out.
Their PR department's doing that right now with with the HealthLink referral. They're talking about this 50,000 people that we've punted over to HealthLink. They're not going to talk about the fact that the majority of these calls that they transfer to HealthLink just come back to EMS anyways. They don't mention that fact.
I'd like to ask one thing, just out of personal curiosity, regarding fire and EMS. I know it was recently proposed by a mayoral candidate, but not he didn't win. It was Jeff Davison. He was saying that one way to help ease the burden on EMS and EHS right now is to try to get, I think it was EMA trained or something, people onto fire trucks, hire more paramedics basically and put them on the fire trucks because the fire trucks are often the first people to the scene for a lot of the mental health and a lot of the overdose and stuff like that, and they can't do anything about it. So then they're sitting there waiting for an ambulance. What are your thoughts on that?
Well, that is a great topic. And I'll tell you, the paramedics who really want to be part of a fire department would love to go and do that.
Yeah.
They really would. There are integrated services in Alberta that work really well together. But if you take a look at places like Red Deer, one of the problems is that AHS still runs the ambulances even though they're staffed with firefighters. Every firefighter in the city of Calgary right now and Edmonton is MFR trained already. They give great primary care. There's even a few paramedics who used to work for AHS that I worked with who now work for fire. They're still paramedics. They don't have the ability to actually do the ALS interventions because they're working as firefighters, but they're great primary.
So it's more just red tape.
Well, no, I mean, and it's great to have really competent medical trained people on the fire. And most of these crews, the fire crews, when they come to your house, they're really competent, but they can't transport. Although historically, there have been more than one patient transported to a hospital in a fire truck.
Yeah.
Or in a police car because the ambulance was too far away.
Yeah, and I think the point of this was to just get rid of some of those calls where people don't need to be transported.
Fire used to do 6 things for AHS. Now they do 5. Okay? They do first response for critical patients. They come to carry big patients and help us lift. They come to help us gain access and egress. They come to help us do CPR for critical patients. And what's the other one? Can't remember. They used to drive for us, but they don't drive for us very much anymore because AHS doesn't want them to. And quite frankly, we always ended up with the junior guy driving. And sometimes they just, we're not ready.
Yeah.
But no, fire does a great job.
The rookie.
I've worked in systems. Regina, for instance, has a separate extrication department that's part of their EMS. They don't use fire.
Yeah.
I've worked in Israel as a paramedic. We don't use fire in Israel for anything. They fire. We have our own.
Yeah.
They do extrication, building rescue, that kind of stuff. But fire has a job to do.
Yeah.
We're grateful for their attendance. They've been a big help on more calls than I can remember.
Yeah.
But they're not transport capable.
Yeah.
If you need a paramedic and an ambulance to get you to the hospital, that's what you need. So respect,
Yeah. Yeah. I think myself, as much as our viewers, just trying to get the information how we understand it. I own a couple marketing companies and a couple promotions companies. I work with dozens of different industries. And my job in those industries is to deliver the information from those industries to the consumers in a way that a consumer can understand it, and not the way that an accountant talks about it, not the way that a golf course talks about it, not the way that an oil and gas company talks about it, right? So to take these issues, to me, it sounds like a great idea. I'm like, oh, sweet, fire is there, and they got nothing to do. Yeah, sure, they can be like, oh, you're just having a mental health problem. We got somebody who's good for that. Yeah. So it's interesting to just be able to, because these are headlines. That's what they are. That's what I brought up, was a headline. Right? It was a headline from a candidate, and that might have been all it ever turned out to be. You know what I mean?
You dig a little deeper.
Why it's like it's taking these issues that people like myself hear and trying to shed better light on that.
Good.
Yeah.
Because that's what this needs. Yeah. It's really hard to understand medicine, healthcare especially. Who's your favorite healthcare reporter?
I don't have one.
Exactly, because, who's your favorite sports reporter?
I don't watch much sports these days.
Well, but there's lots of them out there, right?
Yeah. Yeah.
So, but for journalists that really understand healthcare well, when I worked with Kathy Lee from CTV back with 2-3 years ago, we did a documentary that's 45 minutes long.
Yeah.
That took 18 months of work.
Yeah.
And she learned very quickly. There are great journalists in this town that understand healthcare file, but it takes a lot. Well, fire, for instance, how are they funded and mandated? Nationally. There's a fire code. That's why there's a fire station everywhere. Yeah. Ambulances, how many ambulances are required to be had in the city of Calgary? There's no number. There's no mandate. Yeah. So it's what you create. Yeah.
I want to, and like we may chat more. We may as this story keeps going on, like anything that we can do to get this out there to support it. We'll do everything that we can. And I want to thank you guys for doing what you do and getting the story out there. And
if you ever
making sure that people understand.
Yeah. If you ever want to jump in a vevehicle and go do a little tour, talk to some people.
Yeah. Yeah.
Go to the hospital.
That'd probably be insightful. Yeah. Right.
Yeah, it's always that offer's always open.
Yeah. Yeah. If we can show it somehow to our viewers, then that's probably even more powerful. Right. So
it's tough.
We can chat further about that as well.
All right.
Okay.
Thanks.